Every year, vaccinations save millions of lives, and the COVID-19 vaccine may be do same for you. The COVID-19 vaccinations are secure and powerful, offering solid effects against fatal sickness. According to WHO, those who have not had a vaccination have a COVID-19 death risk that is at least 10 times greater than that of those who have. Even if you have COVID-19 before, getting the vaccination is as soon as it is time is crucial. You can build up immunity to COVID-19 more safely by getting vaccinated than by becoming sick.
There are more vaccine candidates simultaneously in the pipeline for COVID-19 than ever before for an infectious disease. All of them are trying to achieve the same thing, immunity to the virus, and some might also be able to stop transmission. Here are some COVID-19 vaccines that are recommended for you. Pfizer-BioNTech. The vaccine is safe and effective for all individuals aged 6 months and above. After 2 doses, it has the highest efficacy in preventing symptomatic cases in phase 3 trials. Oxford AstraZeneca uses chimpanzee adenovirus to carry spike proteins from the coronavirus into your body to create an immune response. It can also be kept in a regular refrigerator. Coronavac or Sinovac uses an inactivated form of the COVID-19 virus. Can be offered to people who have had COVID-19 in the past. Works by teaching the immune system to make antibodies against the SARS-CoV-2 coronavirus. Sputnik V produces protective neutralizing antibody tetrates against new strains including alpha B11. It is based on adenovirus DNA in which the SARS-CoV-2 coronavirus gene is integrated. A fragment of tissue type plasminogen activator is not used, and the antigen insert is on a modified full-length S protein.
Which of these vaccinations is more effective than the other? Is a question you will worry have. Due to the various methodologies used in creating individual trials, it is hard to directly compare vaccinations, but overall, all of the vaccines that have gained WHO emergency use listing are extremely effective in reducing serious illness and hospitalization brought on by COVID-19. The mechanisms through which virus vaccinations provide protection vary. However, the body is left with a supply of memory, T lymphocytes and B lymphocytes after receiving any form of vaccination, which will continue to remember how to combat the virus in the future. After immunization, the body normally produces T and B lymphocytes a few weeks later. Because the vaccine did not have enough time to offer protection, it is possible for a person to contract the virus that causes COVID-19 shortly before or just after immunization and then before ill. The process of developing immunity following vaccination might occasionally result in symptoms like fever. These symptoms are typically indicators that the body is developing immunity.
The COVID-19 vaccine is safe, and obtaining it will lessen the risk of contracting the disease severely and passing away from it. After receiving a vaccination, you can suffer a few minor side effects. These are indicators that your body is fortifying its defenses. Experiencing side effects after getting vaccinated means that the vaccine is working and your immune system is responding as it should. Vaccines are safe, and getting vaccinated will help you protect against COVID-19. Reported after getting a booster shot are similar to those after the 2-dose or single-dose primary shots. Most side effects were mild to moderate. The most commonly reported side effects were fever, headache, fatigue, and pain at the injection site. Common mild or moderate side effects are advantageous since they demonstrate the effectiveness of the vaccination. Even if there is no adverse effects, the vaccination may still be beneficial. It implies that each person reacts differently. Mild to moderate adverse reactions, such as low-grade fever or muscle aches, are common and not cause for concern because they are indications that the body's immune system is reacting to the vaccine, specifically the antigen, a substance that triggers an immune response and is preparing to fight the virus. After a few days, these adverse effects often go away on their own. COVID-19 vaccination adverse effects are common. Like every vaccination, the COVID-19 vaccine can have adverse reactions. However, the majority of them are mild to moderate and pass on their own within a few days. Clinical study findings have demonstrated the possibility of more severe or protracted adverse effects. Adverse reactions are continuously tracked with vaccines. Most COVID-19 vaccination adverse effects that have been reported have been mild to moderate and have only lasted a few days. Soreness at the injection site, fever, exhaustion, headache, muscular pain, chills, and diarrhea are typical adverse effects. Depending on the particular vaccine, different adverse effects have varying post-vaccination risk.
Adverse effects are another category, as are less frequent ones. Less frequent adverse effects. A person should be asked to remain at the immunization site for 15 to 30 minutes after getting the vaccination so medical personnel are on hand in case of any adverse reactions right away. If somebody has any unexpected side effects or other health issues after receiving a vaccine, such as side effects lasting longer than 3 days, they should contact their local health professionals. Severe allergic responses like anaphylaxis, which are far less common adverse effects documented for some COVID-19 vaccinations, are exceedingly rare. Long-term side effects. After receiving a vaccination, side effects frequently appear during the first few days. Hundreds of millions of vaccinations doses have been given since the first mass immunization campaign began in early December 2020. There have been worries that receiving the COVID-19 vaccination might cause COVID-19 infection. However, none of the licensed vaccinations contain the live virus that causes COVID-19. Therefore, getting the disease through a COVID-19 vaccine is not possible. The body typically needs a few weeks to develop antibodies to SARS coronavirus 2, the virus that causes COVID-19, after immunization. Therefore, it is feasible for someone to contract SARS coronavirus 2 immediately before or after receiving the immunization and still become unwell with COVID-19. This is due to the vaccine's inability to offer protection just now. Mild side effects after vaccinations are typical. Vaccines are intended to provide protection with the risk associated with contracting the disease. When getting shots, it is normal to suffer some mild to moderate adverse effects. This is due to the fact that your immune system is telling your body how to respond. It raises your body temperature to destroy the virus and increases the blood flow to allow for the circulation of more immune cells.
To cope up with the side effects of the COVID-19 vaccines, here are tips to relieve or reduce the pain. For the adults, to relieve pain or swelling on the arm where you got the shot, apply a clean, cool, wet washcloth over the area. Use or keep moving your arm. Also, if possible, get some rest. To reduce discomfort from fever, drink plenty of fluids, dress in comfortable clothes, talk to your doctor about taking over-the-counter medicine such as ibuprofen, acetaminophen, aspirin, and only for people ages 18 years or older, or antihistamines. It is not recommended to take these medicines before vaccination to try to prevent side effects, as it is not known how OTC medicines might affect how well the vaccine works. Regarding the children, find out what non-aspirin painkillers to use from your kids, healthcare professional, and what additional measures you can do at home to reassure your child following immunization. After 24 hours, if the redness or pain where the injection was administered worsens, contact a doctor or healthcare professional about a side reaction. Additionally, if the side effects bother you or if they do not seem to be going away after a few days.
We are powerful. We are resilient. And together we can overcome this. But because of how stressful these times are, it's crucial to practice proper self-care. Be feeling overburdened, nervous, or fearful is common. There is still hope. Speak with someone, get in touch with your friends, keep in touch with your neighbors, and remember that you're not by yourself. We've gathered the latest expert information to answer some of the most common questions about COVID-19 vaccines. Keep checking back as we will update you for more information.